Disease Awareness Day. When you have a spinal cord injury and it's affecting the cervical, thoracic, lumbar, you go through changes. We're going to talk about complex seizures with Todd's paralysis. So, once again, this is one of the rare illnesses that I have that was developed after the spinal cord injury I had in 2015. Remember, I'm not a professional, I'm not licensed. I'm just a human being who's literally been through it, who's literally going through it. But y'all have Google it at your fingertips and you can educate yourselves at your leisure. And I'm going to check notes. I share my story, but what I have and how I experience it is going to be different for everyone. So we're going to start here. Complex seizures are neurological seizures in which usually seems like a person is daydreaming or that blank stare, unaware of their surroundings, can usually last 30 seconds to 2 minutes. They are unable to respond. So we'll start with the seizure part. Now, I had not had seizures in the past. So when you have a spinal cord injury and you go into, like we talked about, the spinal cord atrophy, and then we're going into this, everything is just a piggyback of everything else. And so therefore, it's considered a neurological, non-epileptic complex seizure. So it still shows the same, but diagnosed-wise, it's non-epileptic. After the seizure, which for me, the seizure usually, my seizure, it doesn't even last that long. I mean, maybe 1 minute at the longest. But see, because I'm the lucky one, I go right into what's called Todd's paralysis, also known as Todd's palsy. Not everyone who has seizures or epilepsy experiences Todd's paralysis, but Todd's paralysis primarily comes after a seizure. And in most cases, people who have gotten it after a spinal cord injury. We'll talk about the Todd's paralysis advancement. So once I have this said seizure, I go right into Todd's paralysis. With that, it is the happening after a brief period of temporary paralysis, usually on one side. You start to get an aura, which is very indescribable, and even says that it's indescribable feeling. And I'm like, when I was reading it, I was like, yeah, it is indescribable. You just feel like some kind of way. And the first time it happened, I'll never forget, because obviously it resembled stroke-like symptoms because it affects one side of the body. You go into a paralysis. So the brief period, usually one-sided, can look like a stroke, can last 30 minutes or up to 36 hours before it resolves completely. During that time period, can have slurred speech because of swollen tongue, still some numbness on the side that was affected, disorientation, extreme fatigue, dizziness, all of those things. First time it happened, we thought it was a stroke. Had to go to the ambulance. They take you in as a stroke alert, which is the scariest thing ever. So for me, even though the seizure lasts a little bit of time, the Todd's paralysis pretty much kicks in almost at the same time. And it does take about 24 to 48 hours for it to resolve completely, right? Meaning the slurred speech and stuff like that. However, because I have all of these other piggybacks, recovery from it can take 2 to 3 weeks. I had an episode 2 weeks ago, and I'm still, it's like you're pushing through. It's that fatigue, but you can't sleep, you can't get comfortable, and then when you do sleep, you're sleeping forever, and when you're awake, then you can't fall back asleep. It's this whole thing. Who can tell before I do? Because I'm not looking in the mirror if we're sitting here watching TV. So if she sees my face and it looks like I saw a ghost, well, let's get you to the room. Before you can't feel that side of your body. You don't know if it's a stroke, unfortunately. When it happens, you do go in as a stroke alert because you can never be too sure. You can't tell whether it's a stroke or not. And that's the part that I think is the scariest. We all have a plan of action. We're starting to track and see what are the things that I did that day, that week, that month, that then I had the seizure. And trying to catch a pattern, right? It's monitoring blood pressure. It's moderating all of these things. And once you're able to get that pattern, it does make it easier. But in order to have a pattern, you have to know what it is. So, complex seizures, Todd's paralysis, also known as Todd's palsy, all right? We're going to move on to the next one. Remember, y'all, you're not alone. We're in it together, and I love you.